from my side, I could say there's a big difference between health and safety and legislation, and they're two separate things. If a director, for example, had the virus, you could isolate him in a sealed room on set with no one near him, and technically he would be safe to be there and healthy because he can't spread it to anyone. But that doesn't fit in to what the legislation says, which is obviously about isolation and bubbles and close contact. So it's kind of understanding that there is two sides to this. There's legislation side and there's health and safety side.
Hi, my name's Emma Turner. I am the CPD lead here at Screen Skills. I'm thrilled that we've been able to put together this session, COVID Health and Safety Roles, Responsibilities and Regulations. Just to give you a little bit of background, in June this year, the British Film Commission published Working Safely During Covid-19 for film and high-end television drama production. The BFC regularly updates those guidelines and we post the guidelines on our website. I now want to thank and introduce you to the speakers. We've got Jonathan Bradbury, who's Head of Safety Services at First Option. We've got Hannah Clark, who is a Health and Safety Consultant at First Option. We've got Andy Harris, who is Managing Director of MSS and a Health and Safety Consultant. And then chairing today, I'm delighted to say we've got Ismena Deacon, who's Head of Business Compliance at Pinewood Studios Group. They're going to talk to you in two sort of areas. First, looking back on what the last 6 months has been like for them. And then secondly, to kind of do a little bit of gazing into the crystal ball to see what the future might look like. So without further ado, I'll hand over to Ismena. Thank you.
Thanks, Emma. And thank you to Screen Skills too for setting up this event. This is a very challenging time and many changes have had to be made to the way we all work in the industry and in a very short period of time. So events like this and the training provided are an invaluable resource to help us all adapt and ensure productions can both resume and importantly continue in a way that keeps us all as safe as possible. Certainly found on the scripture productions that have returned to Pinewood and Shepperton Studios, there are commonalities in what's being put in place and there's also differences in approach to the COVID challenge. Some of which are driven by where the productions were in their overall schedule when lockdown happened. A production needing to come back and do some reshoots has a very different driver from a production starting construction on a sort of 9-month programme. Hannah, I know you've been involved in a number of different productions over the last 6 months. Could you highlight some of the commonality and some of the differences between them in terms of approach to the COVID challenge?
Sure. One thing that's common between all of them is that they're trying to bring together people who have a range of different perspectives on the pandemic. Some people who feel very anxious and worried about being back at work again, and then those who are non-believers. And it's trying to bring together people from those those different parts of the spectrum. I mean, something that high-end TV and films have an advantage compared to other types of productions is they have the time to plan about what they'll do and they have the resources to put things in place. On the dramas I've been on, I mean, at an early stage, it's been working on the procedures, which has been something common in all of them, having really good, thorough written documentation to communicate what's needed. We have a lot of things like our risk assessments, which not always easy to digest or find the information you want. So it's been very important to have things like procedures to set a standard for everybody. Say, you might have been doing things this way on this different production, but here on our productions, we do things like this. And it's been really important to have that clarification in the standards that people expect of their crews to work towards. In terms of the differences, I think it's been different productions I've found have dealt differently with the actual realities and practicality of what they're doing. You can have beautifully written procedures and protocols, but you need to be able to apply that to the real world. And I think for some, it's been a bit of a shock when they actually get there on set, trying to manage the problems. We can write down, people will stay 2 meters apart, but how does that work in reality? How is everybody going to be able to do what they need to do in order to achieve what we want to? And I think it's everything we want to is achievable. It just takes that extra time, that extra planning, and thinking about how it's going to work in reality, building the team around you to ensure that you can meet it. Because on some of them, I've been there and found that it's not quite been enough. We've had to adjust some of the way things are being managed and target problem areas, because this is constantly changing. And even if you have the most perfect plan, you can still find yourself fighting fires on the day. So I think it's important to be able to plan as much as we can for that and be flexible to adjust our plans depending on the risks that we're taking.
Yeah, I totally agree with you, Hannah. We very much, when it was lockdown and production wasn't in progress and we're planning for the return, when you suddenly get to site and you look at it, it's not a whole different ball game, but you have to tweak it and you have to stay flexible. And one thing we found interesting is crews that have moved from one production to another already within and coming to our different sites, and just physically the sites are different, so you have to adapt your plans to make it. The fundamentals are the common theme, but how they're applied has to adapt to the situation and the physical infrastructure that's there around you. So
and specific as well. This isn't something we can copy paste at all. We have to think carefully about each thing we're attempting. As you say, principles remain the same, but we have to look at each one holistically and look at what specific things we need to do for what we're trying to attempt.
Jonathan or Andy, do you have anything you'd like to add to this question on some commonality and differences between productions?
I think I can understand entirely, obviously, what Hannah's mentioned about the fact that on a high-end TV or feature film, there is a bit more time. Whereas if it's a commercial, one-day commercial, you're doing tech recce on a Tuesday, prep on a Wednesday, and then you're shooting on Thursday. That time is just compressed so much, and it's difficult to have everything in place within those timescales. So yeah, it does differ very differently between the sort of projects that you're on.
It's the old problem of theory and practice. So you can have the world's best looking risk assessment, but if it doesn't actually work in practice, then what's the point of that document? So it's really thinking through every element as well, and just making sure that you've got that proper pragmatic practice on site on how you're going to control the COVID risks.
We've obviously talked, there's differences and there's commonalities, and there's a lot of different things to think about. But what, I don't know, maybe Andy, you can take this first, but what have you found to be the biggest challenge so far?
I suppose if we put it into two sides, we put it into the sort of like the pre-production side of it in the planning as a safety advisor out on jobs, and as the team that are out on the jobs, is we're safety advisors. We don't have all the answers, and we get in so many questions about their HR questions, their medical questions, and then curveballs coming in that I had this week, where you've suddenly got American Screen Actors Guild and Directors Guild of America coming in with their regulations as well as curveballs. You think you've got everything planned the way that you're going to set up, you suddenly learn that the Screen Actors Guild have their requirements to interface as well, and there is no one size fits all. It's just such a hectic and chaotic environment at the moment because it's such an early thing. I suppose that's in the pre-planning stage. That's what the biggest learning is. And then obviously during the shoots themselves, I think it's when you're actually on the shoot and things are actually happening on day one. I've explained to so many people it's not going to be perfect. We're not going to be exactly perfect as we expect, and we haven't come across a single perfect production yet. Everyone's trying, but aiming for perfection is not going to happen. It's still very early days, but I think it's that people management on the job. It's having that when you're day one of shooting, it's having that strong AD team to work with, that the safety advisor or the COVID supervisor or other people in those roles are now stepping up quite a level, and they're working within the AD team and within that production management team, and having that strong AD team on location to enforce what we need. That's kind of, in my opinion, that's what is one of the biggest needed things to make things work and to make things succeed, because we can't be everywhere and there's only one of us. So really sort of saying people are the biggest challenge, I get, which kind of feeds back to what Hannah was saying at the beginning about the different approach. Some people are very anxious about this, and other people are kind of almost deniers and sort of, it'll never happen kind of thing. So, and it's very hard to manage that range of emotions, if you like, on top of all the extra measures and everything that needs to come in. There's that people element. It's not just about doing the job they've been doing for however many years. It's this extra element in a very short space of time, bringing people up to speed on. Exactly.
Yeah, I agree with you on that.
It's people doing things that they've always done, they've done for 20 years, and they've now got to relearn stuff. If someone goes to catering and brings everyone a load of coffees back, they've got to have a mask on. They're carrying a tray of coffees, they're exhaling over that tray of coffees. They've got to have a mask on. And sometimes it's not someone doing it saying, oh, I don't care about this. It's they just forget. It's a whole new way of working. The job.
Human behaviour, hardest thing to change and influence, isn't it?
Exactly. And it's instincts to how people do stuff. I had to do a big briefing to people on a job a couple of days ago saying, you can't turn and say, I'm sorry, I don't have time for testing today. I'm busy. I'm on set. I'm a busy person. Everyone's busy. This is the new norm now. You will have to find 15 minutes to go and get your COVID test done. You will have to find time to do this. It's another thing that's come in, and people have got to relearn how we've always done stuff.
It's reiterating it. But every time, I think a challenge that we found is it's not just reiterating. Every time we refresh people, something has changed. There's been an alteration either in what the government is saying or what the BFC is saying. It's a constantly moving goalpost, or it's like being on quicksand, I guess, as well. But it's that dynamicness of the situation. So when you're trying to tell people you've got to still do this, it changes each time. So it's people saying, well, what's the message? What's the message? It is a huge challenge. But I also think that people are up for that challenge and they want to do it the right way. It's just so it's not a lot of resistance to it. It's just continuously putting that message out there.
I was saying, even you see Boris Johnson got it wrong on the news the other night when they asked him about the rule of six, for example. And it's if you have someone unwell on a production and you have to look at isolation and close contact, who they've been in contact with, you're straight on the NHS and .gov websites trying to work stuff out. It's almost like there needs to be massive industry agreed flow chart that just starts at the top with someone is unwell, what do we do now? And you just work through it. But it's a huge task for getting that flow chart sorted.
But then that goes back to what Hannah said, that one size doesn't fit all. So you'd spend a year with some expert on flowcharts trying to develop one, and it would change as you go. So spaghetti junction, I think, would be the result. But Jonathan, have you got anything to add on challenges that you've experienced over the last few months?
Production is, an exact reflection of society. So you've got a number of different, people on site with different behaviours, beliefs, attitudes. So that's the challenge I really, for me personally, over the last 6 months, just dealing with different people's perceptions. But because it is a fast-moving situation as well, the information from the government is constantly changing. So, there has to be that clear communication to all the different departments and all the crew on site. So, yeah, that's definitely been a challenge over the last 6 months for me.
And I think there's been a lot of change over the last little while, and that trying to change people's behaviours, trying to change what we're doing. And one of the big changes from our people is the requirement for dedicated COVID personnel. This didn't exist before, obviously. And we found that productions have varied enormously in their approach to what that requirement means in practice. Some have engaged health and safety professionals, some medical professionals, others, particularly straight post lockdown, when it was we want to get back. They had personnel who weren't otherwise engaged, like location managers. They weren't going on location. We've got these personnel. Can they be used as COVID supervisors? Are great people to be doing it. They're used to getting things done. So, but it's been a huge variety of who has been employed as a COVID representatives or supervisor. But maybe Jonathan, could you enlighten us? What COVID roles have you or First Option been asked to fulfil, and what other roles have you seen productions using?
I guess we're seeing like a real evolution of the role since the beginning of lockdown. So, early days, back in kind of March, April, I guess the health and safety advisor on site was seen as the person that kind of fills in the gaps. So, we were asked to take temperature checks, periodically wipe down benches and touch points, change PPE bins, just general information and that kind of thing. And since then, over the last kind of few months, the role has evolved into what we now know as a COVID supervisor as well. And then obviously a lot of the bigger productions have now got their COVID teams. So obviously COVID managers, COVID unit production managers, and they're also sorting out the logistics as well for testing capabilities on site. So there has been a huge shift, definitely in the last 6 months. But I think, obviously, going forward, a lot of productions have also had the benefit of having IPC consultants on site as well. So infection prevention and control consultants. So they're also adding a lot of information and knowledge to the teams on site.
Yeah, I'd agree. We've definitely noticed a change from the beginning, or we'll just have one COVID person, and now the team is growing, if you like, on each production. So Hannah, or Andy, have you got any similar experiences?
I think it varies, obviously, down to the shoot. We had a very small photo shoot in the studio with sort of 4 people in there, and they wanted to have a medic, COVID officer, and a safety advisor. We're like, well, we're adding 3 people now to only a 5-person shoot. So that's kind of, we can be a bit more flexible with that. But then the other side is when you've got a larger feature film and budget allocations and you're trying to work out that. And we had a job we were discussing yesterday, and they explained that they've actually got a full-time COVID production manager full-time that's just implementing all the controls and working with us. And that is so wonderful to hear, because some of the jobs that I've been like popping in and out of, one job I spent most of my time just running around trying to find people to go and have a test. And obviously there's a lot of other stuff which we could be doing. So it kind of, as the jobs get bigger, there's more people available, but it comes down to, as many of us are saying, it's such a new thing. There is no one size fits all. And it's just trying to work out what works on that production without suddenly doing, huge overkill. We've even had jobs where we've had to even like phone like a medical director to get information from a doctor as well for permission for a person to be on set, and that ties in with insurance companies, and it just, everything upscales and downscales colossally. And then there's other larger feature films, and there'll be 20 people on a COVID team because of the scale of it, and it's just having that ability to upscale and downscale relevant to the production.
Yeah, Hannah, have you got any comment on that?
Yeah, I think what I was saying about how it's dependent on the production. I think the requirements change for what people are working on, and I think the type of the type of person, depending on their role, needs to be right for that too. Doing safety advice in TV and film, there needs to be a certain type of personality to give the sort of advice we need to, and to help productions achieve what they want to. And it's similar for this. However, I don't think it's quite the same type of personality. This is a role that that sometimes, as we've been talking about, we get resistance. So you get people not agreeing with us, or trying to argue, or doubting what we say. And we've dealt with that as best we can as we've gone along. But now we've got these defined roles who are there as their enforcement. They're there to ensure that these procedures are actually happening in reality. And yeah, when you get that kind of resistance, I think you need to be quite a strong personality to make people understand that this isn't an option. This is mandatory, and it's for everybody's safety, for everybody's protection. But I think in terms of a broader overview for a COVID compliance officer who's looking after a larger project, they need to be someone who, as well as having had I think any production experience, just know how this world works is fantastic, as well as that technical knowledge of COVID in the form of a thorough training course. You also be, something that the production experience will help with is to be aware of how these risks affect all parts of production, from the script writing to the post-production. Everybody has been affected, but everybody can also help in some way to lower the risk. And I think if you're somebody who has got oversight of this, and has also perhaps a team underneath you, it's great to be able to have that experience and that that sort of 360 perspective to think about, okay, if we do this, what's the knock-on effect here going to be? And if you can have something like that from beginning to end as well, somebody who, when you're script writer, can say, okay, could we change this scene a bit so that we don't have to have these characters together? Or could we have them having a quiet conversation in the back garden instead of at this party? Little changes like that all the way along. I think if you've got somebody who's able to have that oversight over the whole thing, and also how the connections work, how things will affect other areas, then that's the kind of fantastic person you want looking after things for you in regards to COVID.
Yeah, thanks, Hannah. That's very kind of interesting. It's like we've all said, it's definitely evolved over the last few months. Its production resumed, immediately post-lockdown, I think a lot of people thought the COVID role was possibly a temporary measure. We didn't know how long this was going to last, and it's clearly become a much more permanent feature. And like I said, it's evolved as to the type of people that have been the COVID supervisor. It's not just an add-on anymore. It's not just we've got to have somebody, let's put somebody in place who's available. People are starting to think now, productions are starting to think about what they need over a longer period of time. And it's very interesting what you're saying, Hannah, about really at every single stage. It's not just planning from when you're actually on set. It's planning the script, planning from the word go, really, and costume, make up every single element of production. So that knowledge of all the interrelationship of all the different elements is important. And kind of now looking forward, this is here to stay, I think, for a while. So there may be some clearly defined roles, and that the people that are advising at the beginning in the planning stage may not be the people that are advising at the end when you're on site. There may be different elements, different skill sets required at different points. But maybe coming back to you, Andy, can you see sort of clearly defined COVID roles emerging? And as Hannah's alluded to, not just specific COVID roles, but what other members of the production team are going to be key in relation to COVID?
Yeah, so if we're looking at it from a high-end TV feature film bigger perspective, there is a lot more involvement, a lot more roles going to be developing. I've been chatting with Beck too over the last couple of weeks about this as well, because one thing which I've been trying to bottle down to over the last 4 months now is the COVID supervisor role. What is that role? What is it? What is expected of them? And it's and what is their background as well? And I've also been quite my views on the terminology of the word supervisor as well was something where I think if you are a production manager that's been in the job for a long time, has done a entry health and safety course as well, and then has done some COVID training, that's great, and you've got that experience to be on a job in that role. Whereas someone else could come in, you could have a runner could come in that's new to the industry, hasn't had any management experience on a busy production, and they could also be in that role. So it's kind of trying to work out what the roles are moving forward. And that obviously ties in well with what Screen Skills want to do moving forward as well, for new training levels as well, and getting more people understand. I've been speaking to quite a few other people who've been out in a COVID supervisor role and trying to get their thoughts on what are the roles moving forward, what do we all need to have, how do you set up a production with all this in place? Because I think from being out on jobs personally and seeing it, there's someone who's at the side handing out hand gel and putting a new mask on as people going in and out of a location. That's easy to do, but yet being somebody who's actually on set and having to go to a director and saying, "Excuse me, sir, would you mind just putting a mask on when you're near the monitors, please?" That's quite a big thing to do for someone that's new for the industry. So it's just trying to work out what those roles are. I think there's one production company I was chatting to, and I think they'd managed it quite well with what they'd done, where they actually had security guards as the enforcers on location, saying to people, "I need you to do this, I need you to do that. You get a red card, yellow card, then a red card, and that's it. You're asked to go home for the day." And I thought that was quite a good idea, because that is an enforcer who's there making sure people are sticking to what is required. And I hate the word enforcer, but sometimes it is needed. The way I've been doing it, I've been politely reminding people that we need them to do this, because it's in the terminology of how we do it. But for the bigger picture, there's going to be a lot more roles out there. Depending if you're shooting across 4 or 5 stages at Pinewood, then you're going to need a lot more people involved.
And actually, and I agree with you. The enforcement, although we don't, you don't like the idea of that, it is important, because you've got to look at the bigger picture and make sure that, because it from what we've seen from how COVID behaves, it wouldn't take much. Once it's in, if you like, it can spread and shut a production down pretty quickly. So it is making sure that people are aware. And it's what's interesting from what we've all said so far, that it isn't just specific COVID roles. There's a definite need and requirement for specific COVID roles, but every single person on a production needs to be aware of what's going on. And this is where the Screen Skills training comes in again, is that looking at having a basic awareness at least of what it means in terms of your workplace to stay COVID secure. So it's a myriad of different roles is emerging, really. And it's
it was early days when I went out as a COVID supervisor role to see what it was like, but to go up to the director actually to speak to him and have the, to have to go up to the director and say, excuse me, but I really need you to do this. It's, he's quite an important person. I'm a safety advisor, and it's kind of having that, you've got to step up for it. And that's where it goes back to what I was saying, where you've got to, if you are that person out there having production management experience, you've dealt with that side of things in the past, you understand that. But yeah, anyone can then assist you. There's a little feature film that we've got running at the moment, really great team, they're doing it brilliant, and they've got some runners on board new to the industry, and they're just working under the safety advisor as set cleaners, and that works brilliant because they're getting some work, they're getting out, they're cleaning the set. It's kind of, it works really well doing that. So it's kind of different people for different roles.
Yeah, and then just having a real focal point of a main COVID, maybe even a COVID manager as opposed to COVID supervisor, just somebody who's coordinating all the different elements. So yeah. Jonathan, what are your thoughts on the different roles that are emerging?
I think it's a good point that you just raised before, Andy. So obviously we had a query come through recently, and a production asked for a COVID supervisor / cleaner. So I do think that there needs to be a clear definition of the job role for a COVID supervisor as well. It is one or the other, and that's what the health and safety advisor is actually doing at the moment as well on site, is making sure that we're vetting the cleaning contractors as well, and making sure that they are using the correct chemicals and substances, and they know how best to clean on site as well. Yeah, and I think just on your point there about enforcement, it is necessary. Obviously the first thing we like to do as well is obviously engage, talk to people about, why they need to wear certain PPE, why they need to distance and that kind of thing. But if the message doesn't get through, then there has to be that discipline sitting behind that engagement as well. So, obviously, there will be a time to enforce those strict rules on site because they are necessary.
Yeah, thanks, Jonathan. And I think also we're focusing up to now on the sort of health and safety aspects of COVID and making sure that the people are keeping safe. But COVID goes beyond so many things in terms of beyond health and safety, for the logistics planning, for people getting tested, different bubbles, keeping people separated, the sort of human resources related with requirements for isolation if people have symptoms or they live with someone who has COVID, and then there's the GDPR issues with collection of personal data and tracking people. So there's a whole sort of range of different skill sets that aren't just health and safety primarily related that come into it as well. So yeah, I don't know, Hannah, if you want to comment on what training and experience you think a COVID supervisor would need if they're going to cover that, or do you think again it's a team of people?
I think that those aspects are definitely something a COVID supervisor, if they're not looking after them, needs to be aware of as well. What you're saying about how it affects other things. For example, we've got this policy now. If somebody has got symptoms, they're not coming onto our sets, because then they need to ensure they isolate and get a test. But the reality is that person could be absolutely vital to shooting what you want to shoot that day. And there's also the fact that person has booked out that day and has an income that they want to keep up as well. And it's like, how do we manage that situation? Some productions are putting in sort of compensation pay for if that happens. But I'm also telling people, make sure that you're checking who you've got on your books that you could call in at the last minute, or perhaps have on standby for if this happens, because we're talking about planning for all these kind of eventualities. And if we get a confirmed case, if we've been keeping up our bubbles really well, then we don't need to lose the whole production. We're just losing that small bubble of, but say that's the camera team. We can't do very much without them. So it's definitely worth thinking about, our staff, our crewing levels, and if we've got the people there to film what we want to, whatever the eventuality. There's one other aspect I think is very important to consider, really, that I think gets a little forgotten at the moment because we've got so many other things, and that's the mental health effect of this. Of course, the shock of this happening, and then also combined with lockdowns, being at home, losing our freedoms, and then we're back at work again, and we've got to have this thing stuck on our face all day. I could see the frustration, and I can see the irritation and how it affects people just trying to do their jobs. And so, I'm really trying to encourage people to take this into account. If we're going to have a mask at all times policy, make sure that we've got breaks for people to be able to know that they've got a time to take off, and a safe place for them to do so. And just people knowing that they've got that to look forward to, and we've made time in the schedule for it. It makes a big difference. We can, I always try to stay conscious of, yes, we're controlling these risks, and that's fantastic, but what's the effect on people's well-being? This whole thing has and continues to be a bit of a battle between physical health and mental health. Staying at home keeps us safe. It's not great for our mental welfare over this extended period. And it's the same going forward. Though we can't compromise on some of these safety controls. We just allow too much risk. So where we are putting in controls that are pretty heavy going, or are going to have that effect on people, we really need to try and compensate that and find times where we can allow people to rest, relax a bit. That's why things like rest areas are so important when we're looking at our locations, and ensuring that we don't forget those really important things as well. The things that keep people going through really tough days, things like great food, great coffee, suitable breaks. But of course, these all have to be managed in ways to keep the COVID risk low.
Yeah, it's a very good point, Hannah, about the sort of the mental health aspects of these. It is very key, and it's not an easy one because it affects everybody differently. But it's some of those positive things you talked about, having rest areas, having breaks, having time. That's all the time it needs to do that, and just the different approach and the planning aspect. There's a lot of different elements that have almost been forced upon us because of COVID, but they're positive. It's positive opportunities and benefits that come from this pandemic and how we approach it. But it does need thinking about. So that, I think that's a really good point. But are there any? I don't know, Jonathan, have you got any examples of any other positive changes and benefits that have come out of this pandemic? Because we mustn't just focus on the sort of downside of it. There's a lot of downside, but actually there are some positives. Better communication. We're finding at Pinewood, we've introduced meetings between all the different productions on site. That didn't happen before. And you think, well, why did we never do that before? It's a really good way of sharing information. We're all learning these new methods together, new ways of working, and we can help each other. And I think that's very, very important and positive. So, like I say, I don't know if, Jonathan, have you got any other examples of changes that have come about from COVID that we now will keep, even if it's, hopefully we'll get a post-COVID or get to a new normal where it isn't such a key element of the production.
Absolutely. We've seen a lot of positives come about in the last 6 months. And I guess, one of the biggest things is the planning element as well. It's thinking through every single element. And, it could be an example of catering. How do we get, 100 plus people from A to B, in a one-way system to sit distanced apart, eat their meal, and then get them back on set. So, it's really kind of thinking through all these different elements, and then it's the communication as well. So, obviously, with the popularity of Zoom, it's easy now to speak to the different departments, and really break down, the jobs and tasks and activities that they're doing on site as well. Another real positive that I've seen as well is the leadership. So obviously putting, more leadership onto the heads of departments as well to discuss these issues with their crew. So, it might be the mental health element, why are we wearing the masks, why do we, maintain this distancing and that kind of thing as well. So it's really kind of instilling, more confidence and leadership in the HODs to have those conversations with their crew on site.
Thanks, Jonathan. Communication is always great, but it's forcing us into it. But it's definitely a good thing. So, Andy, have you got any other comments or examples on positive behaviour changes and positive changes as a result of COVID?
Yeah, I mean, it's a huge question. Although there's been many negatives, there's been lots of positives coming out of it at all. I think from my side, it's the from our team has seen so many members of our team really stepping up and pushing all throughout lockdown, like working so hard to get everything set up, knowing that the industry was going to be coming back to where it is now, and people just working so hard to do that. And then from the wider production perspective, it's an industry where we are full of freelancers, and it has been quite a bad time for many people, but now it's kind of, there's a lot of positivity. And there's a job I was on yesterday, every single person was positive, doing exactly what we needed to do, making things happen and just embracing it. And that is this industry. It is a very fast-paced, chaotic industry where things happen so last minute, so fast, so quick. I don't think many normal people who aren't in this industry, people outside, are quite aware of how quick and how fast-paced it is and how it evolves and changes and how dynamic it is. But it's kind of, it has proved that we are doing what we can do. And the British film industry especially, is we've got the biggest jobs. They all come to the UK. We've got so many eyes on us from the big US studios and everything to see if we can make this happen and make this work. And we should be quite proud of ourselves. There is no overall, there's a British Film Commission guidance, and that's kind of what we're all working with under DCMS. But overall, there isn't anything. We've all just got to come together and kind of work out new ways of doing stuff. We've got the production safety group meets this afternoon, so online Zoom this afternoon, and that's going to be so much going on with that, information sharing and chats. It's huge. But I suppose the biggest thing is where so many production safety advisors have now we're listened to, people understand us, people want us on board, people are engaging us, listen to what we're saying, and it's really good seeing so many people stepping up and moving into that role.
Yeah, absolutely agree with you, Andy. It's out of a sort of dark time emerges, some great positives, and people can really shine and show how dynamic people are used to working, but how it can come into practice. And like we talked about earlier, about there is some resistance to this, but generally there isn't. And the reason people aren't following procedures is not because they don't want to. It's more about you forget. It's learning those new habits. And as it becomes more and more of a habit, it will get easier. But everybody has a willingness to learn it, because I think also because it affects everyday life. It's not just at work, but there are a lot of positives, and we just need to make sure we're still looking after the more negative aspects, like Hannah mentioned.
We've got lots and lots of questions for all four of you, please. One person asked, have anybody on the panel experienced returning to work after being locked down because of somebody testing positive? And did anything change in the way that production, be it a film or high-end TV, restarted again? Or even as somebody, as you mentioned earlier, a department, a bubble, going off and bringing in others?
We've kind of heard of some. I think that a lot of productions are proactively testing people. So you're going to get some examples where there may be positive tests, but people, let's say, haven't maybe been to site yet. They're testing before people come to site. So, or they're very much keeping it contained within a bubble. So when it has happened, it's not really been in an uncontrolled way. It's been very controlled and very and almost planned for in advance, if you like. But it comes back to that pre-planning. So if you are testing people and there is a positive test, okay, they can't come to site. So what do we do now? And who can cover that? But in terms of an outbreak or we haven't experienced that.
We had a job where it was a testing related job as well, where we had PCR tests for everyone prior to the shoot, PCR tests on day one, and then we did an antibody test a couple of days in as a secondary control measure, which is something that the NHS are doing on NHS people. And what was interesting was we actually had late marker antibodies on someone that did another test, showed late marker IgG markers again. So he'd actually had the virus before, the virus had gone, passed his PCR test, came to set, suddenly we find late markers on him. So it's having that ability to suddenly go, what do we do now? I mean, in that case, so spoke to a doctor, got it all resolved, but it's being ready for those curveballs, those things which and I'd never even thought that would happen, and suddenly this has happened. And he'd had loads of PCR tests before as well, so he'd have been symptomatic in between the tests. It's an interesting way. And then when people do become unwell on set, I think there's the health and safety head, which I have on how we would deal with it, but now it's more about going straight on the NHS website and just following the guidelines on the NHS website, because that is what we have to run off of, as opposed to a health and safety side.
Well, that leads on to another question, funny enough, that came in to any of you. Do any of you feel that health and safety regulations are being, or issues are being compromised because of the need to kind of be first foot forward with the COVID situation?
I think I could, from my side, I could say there's a big difference between health and safety and legislation, and they're two separate things. If a director, for example, had the virus, you could isolate him in a sealed room on set with no one near him, and technically he would be safe to be there and healthy because he can't spread it to anyone. But that doesn't fit in to what the legislation says, which is obviously about isolation and bubbles and close contact. So it's kind of understanding that there is two sides to this. There's legislation side and there's health and safety side.
Because I think it was a worry that, you know, for example, keep doors open to keep the draft. Oh, it's a fire door. What? Keep it closed.
Well, there's a balance all the time, and fire doors is a very good example. People say, "I need to open all the doors for ventilation." Well, if you open all the doors, you're creating another risk with the fire door being open. So it's looking at other ways of, or do many people have to go that way? Can we keep that door shut? If we don't keep that door shut, what other control measures can we put in place? Because the sort of health and safety still in a kind of emergency situation, that's still is more important than COVID. That's still going to be a bigger risk, and that's what we're trying to message out to people. You know, if there's a fire, if there's an emergency situation, that does, you know, don't worry so much about the COVID response. Do the first aid first, and then we'll deal. You know, we have measures in place to say you need to give that first aid, and then we'll look at the COVID sort of fallout from that, if you like. But you know, that emergency has to come first, and health and safety is still, the safety of people from other aspects is still important.
Great.
And just on that as well, obviously the positive to come out of all of this is the planning element. So, you know, as we've been planning about COVID and really breaking down those different elements, you know, we've also been thinking about safety as well. So combine the two, and obviously then you can mitigate a lot more risk as well.
Another question, but you guys touched on it, with crews having to be flexible about their work is, again, tapping into if any of you have experienced problems or good experiences, because crews are moving between productions, and one production will want something to work one way and one the other. Have you then found when they've come onto set, you've had resistance because on shoot I was on last week, we didn't have to do that, or we had to do something else?
I've found so far, I had a situation where there were two productions working with a single actress who was in a close contact bubble on both of them, really. And, you know, our procedures would say you do not cross between bubbles. Once you're in, you're there, unless we work to ensure that it's safe. And it was great. I was with one of them, but they were working together and sort of looking at their schedules together for how it was going to work so that this actress could do everything she needed to do on both, and, you know, finding days where they could isolate her while they worked with other actors. It was really encouraging and great to see that kind of collaboration between productions. But yes, you're absolutely right. Sometimes that somebody will come along and sort of jokingly be sort of like, oh, well, we had much more on this production, and it's kind of great to hear that, because they've done that, and that set their standard, and you know, for somebody to go, especially for their first job back, because there are still people who are doing their first gigs again since lockdown, to have one that's of a really good standard then sets that bar for them, and you know, I think people are hesitant sometimes to speak out about safety problems because it might rock a boat or two, or annoy somebody. But I also feel that because the way this has changed risks on production is previously the risks that we took predominantly affected the space we were working in. This is bigger. This is a public health risk. So I feel like there is a feeling that people feel strongly about this, especially if they have those at home who are of higher risk, and that's what I'll think about when I'm advising, you know, how it can affect those families of the people, as well as people who are right there on our productions.
Another question that came in was about what have you guys observed as far as equipment cleaning processes and procedures? Does that seem to be working well? And somebody also said, obviously, craft department is incredibly challenging, costume, makeup, art department, whatever. So maybe if you just sort of explain what you've observed departments doing or asked departments to do specifically, and is it now becoming just a new thing they always do?
I think sound has been quite an interesting one personally for me. I think depending on the production, that sound is a role where normally they might have to get quite up close with an actor and to put on the equipment. We're trying to look at ways now of disinfecting equipment beforehand, and we talked about those cleaning standards, and it is important that we use cleaning equipment that we know is going to disinfect this quickly. But looking at where, so if, like, for that scenario, if an actor is somebody who's been doing the job quite a long time and they've done things like TV appearances, they've probably seen a sound engineer putting on that mic many times. So now we're help trying to encourage the actors to work with them and set it down and do it in a way that no close contact is required at all. It does sometimes need really innovative solutions and knowledge from those particular departments. There are some ideas that particular technical departments would come up with that I wouldn't have thought of, because they are the experts in their area. They, it's very highly likely they're going to have a better idea of how to reduce the risk in their specialist area better than me. So I look to them for knowledge.
I think that's a good point, Hannah. I think that we are such a creative industry that the solutions can be found from all within the industry. People are experts. People know how to find a solution. They're very solution driven to get things done in the dynamic situation. So there's a lot of resource there of how to do it better and how to keep doing it better, not just the COVID person or the health and safety person, everybody feeding in their ideas.
I think that's a good point, Ismena, and then you're going to get buy-in as well from the people on the ground as well, and in those different departments.
Thank you. There's two areas of questions that have come up a lot. The first one, I think is quite tricky for this panel in particular and me to talk about, is actually, can you insist on people being tested before they come to work? Have you had people resisting doing that? I know we talked when we were preparing for this panel that, health and safety supervisors now need to be fully trained up employment lawyers as well. But has there been any worries between productions or crews about taking a test if that's what's required to come to work that day?
Nobody's refused a test. Everybody's been keen to get that done. I think a lot of people like it for their own peace of mind as well.
Yeah, I think a lot of people, when it's the antibody test, people really want that because everyone thinks they've had the virus, and whenever anybody wants an antibody test, we always explain it in about 20 minutes. They're going to be quite disappointed when we tell them that they don't have any markers. But obviously, I know people that have had the confirmed virus back in March and already aren't showing antibodies. But with the PCR testing, for example, I know that people, after a while, especially if you've got people being tested every day for some productions or every other day, people don't like it. It's back of the throat, it's up the nose. It's not a nice thing. Some people are totally fine about it. They're like, no, that's great. Other people are a bit, not belligerent, but a bit, well, they're not exactly looking forward to it because it's just an ongoing thing. But for me, I've lost count the amount of both types of tests that I've had. I quite like it now because I know that within 24 hours, I'm going to have like a little badge of honor that I've got. I'm clean. I can walk around and have that understanding. And the industry the employers are paying for it. You're not having to get it done privately. Your employer, even if you're a freelancer, it's being provided for you to know, for you to phone home and say, look, by the way, I've not had it, so it's more than likely that you guys haven't as well. And it's at the moment that is one of the biggest control measures alongside PPE and distancing and all the other things which we've spoken about. But that is something which is, yes, there are false negatives and false positives, and it's not 100% definitive, but it does work to a degree, and it's another level of control measure. It's just about, our head of safety mentioned it a couple of months ago, and it really something which I really sort of embraced. And we can't be perfect, but we can keep putting more and more things, more and more control measures, and they all build up. And testing, ongoing testing, it's part of it now. It's going to happen.
To that end, just on that point, where one of the audience wanted to know if you'd had good private companies, but what's your experience been of private testing companies?
No, I mean, it all varies. It all varies. Some labs, you'll have like results in 12 hours all the time. Then it hits a weekend and then you're waiting for the Monday to get the results back. One of our guys was out on a job and I know that the results came back weren't from his production. They're from another company. So
oh, good. That's working well then. Yeah, anyone else?
Other ways.
The ones I found the administration. Oh yeah, it's been a good thing compared to doing it at home. I've done quite a few of the tests at home when you do it yourself, and I actually did 2 of those before I went to have it done by a medical professional, and it was a medical professional like that. All the ones I've worked with, they're very quick. They know exactly how to brush, like bip, they're done. When I was doing it myself, I was worried about getting a good enough sample and making all sorts of strange noises, trying to get the right bit at the back of my throat. So I feel going with, in terms of test turnaround times, I feel like it's getting quicker all the time. I think quicker testing's going to be our way to getting some of the normality back that we were used to having. It's getting better all the time, and from private companies I've seen a few showcases of the kind of tech that's coming out now, and it really does fill me with hope and excitement that things like getting PCR tests within an hour. You can imagine arranging events around that, come and check in, do your test, and create a COVID-free zone. But these are just that's my imagination getting away with me a bit. The private labs I feel are that's where I'm seeing some really great developments and some really exciting improvements to testing. I won't name any names, but I found them to be really good, really accommodating, and will help productions with their testing regimes and their plans as well. Give them some hints and tips on that too.
Fantastic. Now we're drawing to a close. There's one big question that came up a lot, which is, what's the training for a COVID supervisor? What do I need to be? I'm going to kind of save that for my summing up at the end, and I'll flip to you, the panel, as well. But just a quick one that came up. Somebody was saying, is there a limit to numbers of people on set, i.e., as in the magic number 6? What I would say to the person that asked that, my understanding is the rule of 6 doesn't apply to a work environment. Guys, is that the case, guys and girls?
Yeah, that's right. It's you're at work and you have a COVID secure workplace, and you have all the measures in place that you're following the BFC guidance, you're following the government's guidance. That is, you can demonstrate that it's a COVID secure workplace. The rule of 6 doesn't apply.
In kind of summing up, I want to talk a bit about Screen Skills' role and COVID supervisors, COVID coordinators, COVID cleaners. What we have got coming up in the future is in October, and you can go, we are in October, now in October, you can go onto the Screen Skills website, and with First Option, we're offering 3 training courses that First Option already do and offer, and they are an intermediate stage. You must have done the e-learning module through Screen Skills first, and it's an intermediary stage. That might be for somebody who has responsibility for COVID awareness on top of their job. So that might be sound department, whatever. And then there's also an opportunity for a more advanced COVID supervisor, COVID compliance officer type role. We have asked for both the intermediate and the advanced that people must have. For the intermediate, it must be at least 3 years experience on set. And for the COVID type supervisor type role, it's somebody who is at head of department in production management type role. And I hope that will make you realise that I think we along with the panel and other people are working really hard at trying to standardise this incredibly important training and role. At the end of the year and beginning of next year, Screen Skills will also be offering other CPD training in the area of COVID. We've got it out for tender at the moment, so I'm working with 2 potential training providers to put together bespoke training that we will put some standards around as well. So you can't come from being somebody really very inexperienced moving through to such an important role, which I think the panel's outlined. Somebody else in the chat also said, what about low budget productions? And somebody else said, and what about student productions? Just to let you know, in the next couple of months, we will be doing a session like this, one on a low budget film. I'm hoping that'll be in October. And then we're going to try and do a session with the help of the lovely Sunny from NFTS to put together an advice session for students. So watch out for that. So look, I'm just going to thank the panel so much for giving up their time. To Jonathan, to Andy, to Hannah, and to Ismena, thank you so much. And I hope you've all found this really useful. Thank you.